Health insurance is confusing. To get the most out of your plan, there are some basics that are useful to know. There are three main places we get health insurance: directly from health insurance companies, from an employer, and from the government, primarily through Medicare and Medicaid. The most common types of plans are health maintenance organizations, or HMOs, and preferred provider organizations, or PPOs. Both types of plans use a network of physicians, hospitals, and other healthcare professionals to give you the highest quality care. But there are a couple of key differences between HMOs and PPOs. With an HMO plan, you pick one primary care physician. All your healthcare services go through that doctor. Generally, that means that you need a referral before you can see any other healthcare professional, except in an emergency. Visits to healthcare professionals outside of your network typically aren't covered by HMOs. For example, if you get a skin rash, you don't go straight to a dermatologist. First, you go to your primary care physician who will examine you. If that physician can't help you, she will give you a referral to a trusted dermatologist in your network. The benefits of coordinating your healthcare through your primary care physician are less paperwork and lower healthcare costs for everyone. However, in exchange for a lower cost, you typically have less choice and control. With a PPO, you don't need a primary care physician. You can go to any healthcare professional you want without a referral, in or out of your network. Usually, staying inside your network means lower copays and fuller coverage. If you choose to go outside of your network, you'll have higher out-of-pocket costs, and not all services may be covered. Typically, PPOs cost more than HMOs. However, you sometimes need fewer appointments and you get more choice. A point of service or POS plan is a combination of an HMO and PPO. For example, like an HMO, you may be required to designate a primary care physician who will then make referrals to network specialists when needed. But like a PPO, you may pay greater out-of-pocket costs to receive care from non-network providers. There isn't one answer for everyone in terms of which is the better plan. When it comes to choosing a plan, you should consider your personal needs and the options available to you in your area. There are also short-term plans available for your purchase, but be very wary of these plans. They do not have to follow the consumer protections included in the Affordable Care Act, and they are able to deny people and exclude treatments for pre-existing conditions, like cancer. Additionally, many of them have very high out-of-pocket costs, costing you more in the long run, even if they seem cheaper monthly. Most insurance plans have a network of providers. These are doctors and hospitals that have agreed to be part of the health insurance company's network. If you go to a healthcare provider in your insurance company's network, the provider has agreed to a certain payment rate for treating you. Regardless of what the provider bills, it's that negotiated payment rate that matters to your final cost. There are a few other terms that are used in your health insurance coverage that you should understand. There are costs just to have health insurance coverage. This is called your premium. It's what you pay each month to have coverage. You pay these costs even if you never go to the doctor or get any medical care. It's like paying for car insurance all year, but never getting into an accident. Then there are costs that you have to pay when you have medical expenses. These are going to be different depending on your policy. First, you have your annual deductible. This is the amount you have to pay out of pocket each year before your health insurance policy kicks in. This fixed dollar amount could be $500 or $5,000. It all depends on the plan. Next, there's your copayment, and that is also a fixed dollar amount that you pay when you get certain types of medical care. For example, when you visit the doctor's office, you might have to pay a $20 copayment. If you go to the emergency room, you might have a $250 copayment. You pay your copayment at the time you get care. All plans will also have a co-insurance or cost share, and these two terms mean the same thing. It's the difference in what the insurance company pays for your medical expenses and what you pay for your medical expenses. So you are sharing the cost. For example, if you have an 80-20 plan, the insurance company pays 80% of your medical expenses, and you are responsible for 20% of your medical expenses, once you meet your deductible. Finally, there is your out-of-pocket maximum. This may be one of the most important things to know about your health insurance coverage. Again, this fixed dollar amount will depend on your policy. You reach your out-of-pocket maximum by paying towards your deductible, plus any co-payments that you make during the year, plus anything you pay towards your co-insurance. So it's everything that you pay except your monthly premiums. Once you reach your out-of-pocket maximum, your insurance pays 100% of your medical expenses, and you don't have to pay anything for the rest of the year except your premiums. By understanding how out-of-pocket maximums work, you can plan around what your cost might be in a worst-case scenario, and hopefully avoid financial ruin after a serious medical situation. When thinking about your out-of-pocket maximum, remember that insurance companies usually only count expenses that are from in-network providers. To give you an example of how the out-of-pocket maximum works, imagine if you were in a car accident and you go to the emergency room and then spend a week in the hospital that is in your policy's network. You end up with a $102,000 hospital bill. How much of that do you actually have to pay? Your health insurance plan that has an emergency room copay of $250, a deductible of $2,000, and your co-insurance is 80/20. Your plan has an out-of-pocket maximum of $4,000. So first you have to pay your copay of $250 at the time of your emergency room visit. You subtract that $250 from the overall bill, leaving you with $101,750. The next step is for you to pay the rest of your deductible, minus the $250 you have already paid, which is equal to $1,750. Once you have paid your copayment and your deductible, you are left with a $100,000 bill. Since you have met your deductible, the insurance company will pay 80% of the bill, and you are responsible for 20%, or $20,000. But your plan has that out-of-pocket maximum of $4,000. Remember, you have already paid $2,000 in copayments and deductibles, which means that you will only have to pay another $2,000. We hope that this has helped you understand the basics of health insurance. For more information about health insurance and other cancer survivorship topics, visit triagecancer.org.